Go ahead and get started. People will still be joining us. Welcome, everyone. I want to recognize today's event. This is 40 years after the first cases of AIDS were documented at UCLA, and that first report started an unparalleled search for the causes of death of young men and led to defining HIV as the virus that causes AIDS. At first, the treatments weren't very effective. Many living with HIV died. Some of us who are older remember that, and we'll be remembering some of those folks. They died either from the treatments or from AIDS, but now we have highly active antiretroviral therapies, which are incredibly effective. And it shifted living with HIV from being deadly to being a chronic manageable condition, but still there's a lot of work to be done. And those who have healthcare disparities are often excluded from some of the benefits of these medications. Today, President Biden committed to a global strategy to end the HIV epidemic by 2030. He recognized the importance of addressing healthcare and other disparities to reach this goal on a global level. In today's World AIDS Day presentation, the UCSD Cfar and the UCLA CHIPTS AIDS Research Center will focus on the American experience of inequities and the work that's being done here in Southern California to address the disproportionate burden of HIV and risk for infection born in this setting by Black African-American men who have sex with men and transgender individuals. This includes addressing ongoing and multiple generations of medical maltreatment by the healthcare industry toward Black African-Americans, to recognize cultural factors within Latino, Hispanic, Asian, and Native American communities that promote silence about HIV, to reduce stigma and address the causes of conditions that contribute to stigma, including things like sex work, cycles of incarceration, and the impacts of HIV for both men and women of that, chronic homelessness, and conditions of mental illness and substance use disorders. And finally, just to recognize that we are in an era where we have dismantled and defunded HIV prevention and allocated funds toward COVID-19. Today, we're going to hear about efforts to work with concepts of health and whole person care that build hope for reaching the goal of ending the HIV epidemic here in Southern California. I want to start today by recognizing my partner over many years working on these shared goals. He's Dr. Christopher Gordon. He's the branch chief of the HIV research at NIMH, and he'll be talking with us about the NIH perspective. Chris.
Thanks so much, Steve. And thank you so much to UCLA and UCSD for hosting this event and all of you for attending. I'm really honored to be with you. Your work continues to inspire me. These have been some tough times. I'm well aware of your collective efforts in Southern California to continue the fight for equitable HIV prevention and treatment. So thank you to everyone. We need all of you. We must redouble our efforts to work with communities to address the social determinants of health that are so critical to the national and the HIV epidemic activities. We must have equitable access and everyone's voice. Despite scientific advances, we must acknowledge that persistent structural and systemic inequities that marginalized and underserved communities face accessing services. Informed by voices from the most impacted communities, I promise you that we remain deeply committed to ensuring equity in our research and policies and to serving those most in need of support. Our work, as Steve says, needs to take a comprehensive approach that acknowledges the role of syndemics, such as hepatitis, mental health, and substance use, as they play into the HIV epidemic. The COVID pandemic has threatened hard-won gains, not just in HIV outcomes, but in these barriers that I just mentioned. Drug overdoses have markedly and tragically increased. Mental health problems and violence are up. People have been struggling. Today gives us all a chance to support people living with HIV, commemorate those lost to the virus, and honor everyone fighting to end the epidemic. Let us find strength in each other during these times. And thank you, and I look forward to the rest of the event. Steve, back to you.
Thanks, Chris. Those are great remarks, very moralizing, and that's exciting. As Co-host of our event, Jamila Stockman, is here to talk with us. She is the co-director of the San Diego Center for AIDS Research, Health Equity, Socio-Behavioral Science Core. She's also professor and vice chief of the Global Public Health section of the Division of Infectious Diseases and Global Public Health in the Department of Medicine at UC San Diego. She'll lead us in a moment of silence and our memorial today.
Thank you, Steve. Good afternoon, everyone. Each year, we commemorate World AIDS Day to unite in raising awareness, take stock of our progress in the fight to end HIV, show support for people impacted by HIV, and to commemorate those who we have lost in the struggle. This year marks 40 years since the first few cases of what would later be labeled AIDS were officially reported. It has since claimed millions of lives around the world and continues to be a major public health threat. Nearly 38 million people are currently living with HIV, and each year it claims close to 1 million lives. Although many of those in the field today cannot remember or were not alive to experience the daily losses of the first years of the pandemic, we all now know of the grief, collective trauma, and work of witnessing a deadly pandemic. We would now like to share our virtual AIDS memorial piece. We thank you for taking time to submit names when you registered so that we can honor their legacies. By sharing this, we seek to remember the lives lost, offer healing and hope to survivors, and recommit to the fight against stigma, denial, and hate for a just future. Please join me in a moment of silence as we remember and honor all of those who we have lost to HIV. If you did not have time to submit names, feel free to enter names using the chat function in the Zoom feature. Thank you. Now I would like to introduce Dr. Naina Harawa and Dr. David Goodman. Dr. Naina Harawa is the Director of the Policy Impact Core at CHIPTS and is a professor in the Department of Medicine at the University of California, Los Angeles. Dr. David Goodman is a core scientist with the Combination Prevention Core at CHIPTS and is an assistant professor in the Division of Infectious Diseases at the David Geffen School of Medicine at the University of California, Los Angeles.
Thank you, Dr. Stockman, and thank you for grounding in all of us and why it is that we are here. Next slide. I'm going to be speaking today, not primarily in my role as Director of the Policy Core, but highlighting some of the work that CHIPS has been doing, specifically focusing on ending the epidemic, including research projects that I lead with others in the community, and of course, then Dr. Goodman's going to talk about his research. But first, I want to take a moment to share with you our success in terms of, through our center, getting awarded supplements that are specifically earmarked for ending the epidemic efforts. And we've been awarded several of these supplements. There are 6 on this list. We're extremely proud of that success rate, but what's more important is the focus of these efforts. And you can see there are a broad range of efforts that are designed to highlight key populations that are particularly affected with HIV, and using both innovative and culturally appropriate approaches to reach those populations, and sound implementation science strategies to address both HIV inequities and syndemics. When we say syndemics, we're talking about things like substance use, mental health, homelessness, all of which that often accentuate risk for HIV in our communities. Next slide. I'm going to be focusing in next on some of the research that I've been leading over the last few years. And the goal of all this research can be talked about under the umbrella of integrating research and reentry services in order to maximize the successful health outcomes for people with criminal justice involvement. And on the way, I will talk about why that population is so important. Next slide. I currently spearhead 3 research studies in collaboration with researchers at Children's Hospital, University of Chicago, University of Texas, Houston, to test the effectiveness of interventions in improving health outcomes among populations at risk or currently living with HIV who've experienced incarceration. These studies include the LINK-2 study, the MEP study, and the BAR study. And I will be focusing in on LINK-2 and MEPS. Both of these studies include navigation principles and cash incentives to facilitate access to services upon release from incarceration. And the reason that this period is so important is that it's a period in which there's a high risk of both substance use related harms, but also risk for HIV infection and transmission. And much of that occurs because of lack of ability to either link to care or remain in care because of the chaos, stigmatization, and often barriers to services that people experience during reentry. The BAR study, which I'm not going to focus on, but is a modeling study that's designed to measure the impact of various biomedical prevention strategies, specifically for reducing HIV infection in Black, gay, bisexual, and other MSM who have also experienced incarceration recently. And one of the best, most rewarding things about this work is all of it's done in collaboration with direct service providers in the community and with input from affected communities. Next slide. So I'm going to talk about each of these studies and just to hone in on the MEPS and BAR study. Next slide. So the LINK-2 study is an adaptation of the LINK-LA peer navigation intervention. And that was an intervention trial designed for adults to promote engagement in care and viral load suppression following incarceration. I want to honor Dr. William Cunningham, who passed away last year, who originally led that study. And it was the first study of its type to show that the intervention was better than control at actually helping people maintain viral suppression following incarceration. So in LINK-LA, we adapted in LINK-2, we adapted LINK-LA for younger people and are currently testing it in collaboration with our partners at University of Chicago, the County Department of Health Services, and Children's Hospital. Next slide. This study is so important because HIV prevalence among incarcerated youth is about 3 times that of the general young population. We also know that youth living with HIV have among the worst levels of engagement in the HIV care continuum. And depending on the study you look at, only between 6 and 30% actually achieve and maintain viral load suppression. Existing linkage and retention services are there, and LA County has done a great job in trying to put those in place, but they're often insufficient to meet the acute needs of criminal justice involved youth, particularly in that very high need period that follows release from incarceration. Next slide. So the MEP study stands for Mobile Enhanced Prevention and Support. It's a prevention-focused study designed to engage people in pre-exposure prophylaxis, regular screening, and for HIV, STIs, and hepatitis, and to help them to link to and be retained in treatment for substance use disorders. And we hope that all of that will also encourage people, support people in not becoming involved in things that might lead them to be incarcerated once again. And that study involves a collaboration with Charles University Friends Research Institute, including Kathy Reback of CHIPTS, and the LA Center for Alcohol and Drug Abuse. Next slide. So why is this study important? Here we're focusing in on prevention. And one of the tragedies in many ways of 2021 is that so many people continue to contract HIV, even though we have now a multitude of tools to prevent it. But we still have many challenges that society presents to individuals that make it hard for them to access those tools. And we know that minorities, whether they're racial and ethnic minorities, sexual or gender minorities, people who have substance use disorders, and people who've been incarcerated are increased risk for contracting HIV, as well as other sexually transmitted infections. And as I said already, re-entry is a particularly risky time for substance use related harms, with overdose being one of the biggest and most serious of those harms. Next slide. So in short, we have 3 projects with one mission, and that mission is improving people's lives and their health through research and collecting the data to really inform future interventions that can reach the populations, one of the most vulnerable populations that has not yet successfully been reached with some of the efforts to end the epidemic. I would be remiss though if I didn't make one policy point here. When I found this slide, I actually first thought the sign said free to vulnerable, and it really made sense for me about what happens often when people leave incarceration. They get their freedom, but they're often very, very vulnerable during that period. The slide actually says free the vulnerable, and it was actually part of many efforts that happened during the pandemic to encourage release of people who were incarcerated because they were at such high risk for COVID-19 during incarceration. And I just feel like it's important that we keep engaging that policy conversation as well, because unfortunately people in those settings continue to be at high risk for COVID-19. Next slide. So I just want to emphasize what I said earlier, that community stakeholders help drive this research, and they also provide a lot of inspiration to those of us who are doing it. Next slide. And just end by saying we still need your support. If any of these studies seem interesting or important for your clients, we would love to hear from you. The COVID-19 pandemic has limited our ability to recruit. And on the next slide, you'll see our contact information. Next slide. As well as our social media information. Danielle or Darlene can connect you with the link to study, and Gabe or Gregory can connect you with the MAPS project. And thank you very much. Oh, and now I'd like to introduce, I'm so sorry, Dr. Goodman, Dr. David Goodman, who I've had the pleasure of working with, and he's going to talk about HPTN 094.
Hi, well, thank you, Nina. So I'll be talking about HPTN 094 Integra. This is a study that is being funded by the National Institutes on Drug Abuse and being run through the HIV Prevention Trials Network. Next slide. This has a really long title, but that tries to summarize kind of the entire purpose of the study in this one long and awkward sentence, which goes: a vanguard study of health service delivery in a mobile health delivery unit to link persons who inject drugs to integrated care and prevention for addiction, HIV, Hep C, and primary care. And really what we're trying to do is test the hypothesis if delivering services to where people are, and in this case, specifically people who inject drugs and use opioids, does this improve their health outcomes? So this is a very traditional study in the way that it's a 2-arm, individually randomized controlled trial, but very different to a lot of studies you might be hearing. There's no real experimental medication involved here. Really what we're testing is 2 different models of care. Next slide. And this study is being run in Los Angeles, where I'm at, Houston, Philadelphia, Bronx, and DC. Next slide. And really, we feel what makes us unique is that we meet people where they are at. And this is possible through these mobile units that was provided to each of the sites that can move, can be deployed, can go to spaces where we identify that there are increased markers of injection drug use. And when we're there, we can provide clinical services at the point where the individual may be. Next slide. This is what the unit looks like inside. I mean, it's mostly like any other doctor's office, but on wheels. It has one large exam room, another area in the middle, which is kind of an admin office or where our phlebotomist takes blood, and another little side office. Next slide. And this is really what we're trying to compare. So the study has 2 arms. In green is the intervention arm, which is the mobile unit arm, where through the mobile unit, we're providing this one-stop shop of services additionally with peer navigation. And this includes medications for opiate use disorder like buprenorphine, antiretroviral therapy or PrEP for people who are at risk for HIV, and then services for Hep C, sexually transmitted infections, basic primary care, and harm reduction services. We're out there, we're out on the street, we're providing clean syringes, we're providing naloxone. And then the other group in the bottom, which is in blue, is the active control arm, where everybody in this arm gets a peer navigator that helps them get to these same services, but at already established community clinics in the community. And these services are provided for 6 months where we do our first evaluation, and then at 12 months where we do our secondary evaluation. Next slide. So what's peer navigation got to do with it? And I thank Nina for kind of her introduction into peer navigation, but really we use kind of individuals who have shared lived experiences or demographics. So a history of using drugs, injecting drugs, or living with HIV, being at risk for HIV, or homelessness, which are kind of key determinants in many of our participants. The intervention uses social learning theory, where we learn from direct experience and by interacting with people who are similar to us. It is a very collaborative and encouraging style. And it really helps participants create and react health goals and address nuanced barriers to treatments. And then ultimately, they additionally provide referrals to community services, as well as education around certain barriers that they might identify in potential participants. Next slide. So nationwide, we're trying to recruit 860 participants, and that would be about 170 participants at each site. And everybody gets randomized 1-to-1 to either of these arms. We're trying to be very reactive to the current opioid epidemic, where we have set ourselves very strict quotas related to enrolling women and enrolling young individuals. And then we also have a stratified sample where we're trying to enroll about 50% people living with HIV and another 50% of people at risk for HIV. Next slide. These are our inclusion criteria. We're including people 18 to 16 years of age that are diagnosed with opiate use disorder. It's not on the slide, but are also injecting drugs. They need to be willing to start a medication for opiate use disorder and have at least one HIV risk variable. Next slide. And then if they're already enrolled in some other study or they're already in treatment somewhere else, this is an exclusion criteria. So we're really looking for people, the kind of hardest participants in many ways, which are people who are totally out of care. Next slide. What we're trying to do is to see if this mobile unit intervention improves these primary outcomes, which one is keeping people alive, 2, keeping people on medication for opiate use disorder, and then 3 is HIV related. So if somebody's living with HIV, if they achieve viral suppression at 6 months, and if somebody is negative, if they stay on PrEP at 6 months. Next slide. And that's about it. And I'd love to take any questions via email. So please reach out if you're interested in knowing more about the study. Now I'll be passing it back over to Dr. Stockman and also Dr. Eileen Pitpetan, who co-directs the San Diego Cfar Health Equity Socio-Behavioral Science Core with Dr. Stockman. She's also an associate professor in the School of Social Work, San Diego State University, and an associate adjunct professor in the Department of Medicine at UCSD. Thank you.
Thank you, Dr. Goodman. Next slide. Aligned with ensuring that we have meaningful community engagement to address the social and structural inequities to improve HIV prevention and care outcomes, I'd like to introduce the Health Equity Socio-Behavioral Science Core of the San Diego Center for AIDS Research. This particular core was established in 2016, and it's co-led by myself and Dr. Pitpetan. We work to ensure that we are facilitating and fostering partnerships between community-based organizations and academic researchers in order to develop programs to improve HIV care and prevention and to improve upon these outcomes. We also train and mentor investigators with a special focus on uplifting and training women and underrepresented minorities so that they will be well equipped to go back into the communities most impacted and do the hard work of addressing these inequities. And then finally, with input from our community advisory boards, we're able to design interventions that are culturally tailored to vulnerable and or underserved populations. Next slide. So with respect to our community advisory boards, this is a real hallmark of our health equity socio-behavioral science core. And we have two community advisory boards. The first is a transgender non-binary CAB, and the second is a health equity CAB. And both CABs are instrumental in that researchers are able to receive input and guidance from either community advisory board. Feedback from members of these CABs have been critical in ensuring that research studies and interventions are being designed with community at the forefront, and that the research is being implemented with ongoing feedback, specifically as it pertains to developing culturally tailored study materials, and also developing adequate and appropriate strategies for recruitment and retention of study participants from underserved communities. Next slide, please. So for the remaining portion of our presentation, we would like to focus on highlighting some of the points of innovation of the research being conducted by the San Diego Cfar, specifically within our health equity socio-behavioral science core, especially highlighting the work that addresses syndemic conditions such as violence, trauma, substance use, and adverse mental health, and those that focus on reducing HIV-related inequities experienced by various communities that are disproportionately affected or underserved, such as Black, African-American, Latinx women and men who have sex with men, especially young MSM, and people who use or inject drugs. We are excited to showcase various studies that we believe are highly innovative in their application of mobile health or mHealth technology, studies that integrate and utilize social and structural factors and address these issues, and also studies that are centered around implementation science. Of note, we also have studies ongoing that focus on innovative modeling approaches, but for the purpose of this presentation, we're just going to focus on the three first points of innovation. Next slide, please. So the first few studies I'd like to highlight are focused on mHealth, and these studies have a common theme that was shared by both Drs. Harawa and Goodman, in that peer navigation is a central focus of these particular projects. So this first mHealth study is called Link Positively, and Link Positively is led by myself and colleagues at San Diego State University. It is a culturally tailored trauma-informed app created for Black women living with HIV who are also affected by interpersonal violence. And the app was created through a series of focus groups and pilot testing with Black women living with HIV, as well as Black women who have a history of serving as peer navigators or are currently serving as peer navigators. And the overarching goal is to improve HIV care outcomes as well as adverse mental health outcomes. And the app is multi-component. There are various components, including a virtual one-on-one peer navigation portal to facilitate skill building to cope with barriers and navigate not only HIV care, but care related to other co-occurring conditions such as mental health, substance use, domestic violence. There's also a social networking platform for peer support, educational tips that are provided for women specific to co-occurring conditions of violence, mental health, and HIV, a medication self-monitoring reminder system, and a GPS-enabled resource locator for HIV care and support service agencies. This study is currently being implemented in San Diego with plans to expand to Los Angeles in January of 2022. Next slide, please. The second mHealth study is called Youthrive, and this is being led by Dr. Keith Horvath at San Diego State University. And Youthrive is a mobile enhanced website to improve medication adherence among youth living with HIV of all genders and orientations. And it is multi-component as well. There are many different features for this particular app, including a social networking piece, tailored HIV and ART adherence information through educational tips, weekly engagement through text messaging with the participants, and there's adherence self-monitoring system, as well as mood self-monitoring to be able to monitor how the participants are feeling. And there's also goal setting and gamification components that are used to encourage engagement with the app. And this particular project is currently being implemented in 6 cities: Atlanta, Chicago, Houston, New York, Philadelphia, and Tampa. Next slide, please. And then the final mHealth study that I'd like to highlight is one that is led by Dr. Eileen Pipitan. And this is an academic community partnership with San Ysidro Health, which is an FHQC here locally in San Diego. And the study is called PATH, or Peers Plus Mobile App for Treatment in HIV. And it's a randomized controlled trial being implemented within San Ysidro Health to evaluate the efficacy of the intervention that implements a peer navigation approach with mHealth technology to try and improve sustained viral suppression among Latinx and Black people living with HIV. For the mHealth components, there are features for both the participants and the peer navigators. So for example, on both the participant and peer side of the app, there are education and self-care tips that help to promote ART adherence skills and also address co-occurring conditions like substance use and mental health. And for the peers, they receive tailored tips to help promote retention of their peer navigation role and to also promote their own self-care and mental health. So this study is also ongoing and actively recruiting participants. So with that, I would like to hand it off to Dr. Pipitan.
Thank you so much, Jamila. Before I start, I just want to address a question that came up in the chat about the PATH app. The question was, does it work on both sides of the border? And it does. It is accessible through any web-based platform, and there's also a Spanish and English version available for our participants. And next slide, please. So in addition to the types of innovative mHealth studies that Jamila just reviewed, we also want to highlight the innovative research that's being conducted to try and understand the complex, multi-layered social and structural factors that impact syndemics, as well as engagement in the HIV prevention and care continuum. So for example, one of those studies we'd like to highlight is called Nexus, and it's led by Dr. Laramie Smith at UCSD and her colleagues. And it's a study that is really using a novel social network approach to measure intersectional stigma among Latino MSM in the San Diego community. Like many other marginalized populations and communities that we work with, Latino MSM don't just live with one stigmatized identity, they live with multiple identities. And Nexus is using social network measures and methods to help us unpack how stigma, in this case, by ethnicity, sexuality, and gender affect HIV testing and PrEP use in this population. And this is another academic community collaboration with San Diego LGBT Center and San Ysidro Health. Next slide, please. Now, another research highlight is the La Frontera study led by Dr. Stephanie Strathty at UCSD and colleagues. And this study is working to examine HIV as well as hepatitis C virus and overdose using a novel approach to think about drug market trends and drug tourism among people who are using and injecting drugs on both sides of the border. So specifically thinking about the individuals, for example, in San Diego, who are traveling south of the border to purchase and use drugs. And what you see here on the slide are the most recent HIV incidence estimates coming out of the study. And data are currently being collected and it's ongoing. But as you can see right now, you're seeing the estimates as being really high. And it looks like there's differences across different drug tourist subgroups in the study. I also want to point your attention to the photos on the right. Stephanie shared a touching story with us about this woman, Yolanda, who was one of the participants from La Frontera and who sadly recently passed away from an overdose. Yolanda was a nurse in the US, but faced many challenges through her life, including dealing with addiction and being deported to Mexico. And she was actually the inspiration for Stephanie's Proyecto Pareja study with women in sex work and their non-commercial sex partners. And from what Stephanie shared with us, it was clear that Yolanda was a beautiful and caring soul, and her loss is felt through the community. Next slide, please. So I want to switch gears a little bit to highlight the directions that San Diego Cfar investigators are moving in the area of implementation science. We have different implementation EHE projects. Can you go to the next slide, please? That are supported through different planning grants and collaborative projects through HIV, between community HIV clinics and academic institutions, community organizations, local public health departments to address high priority gaps to end the HIV epidemic. And multiple awards went out to different San Diego Cfar investigators and their community and clinic partners that we just want to highlight here. And our Ending the HIV Epidemic Scientific Working Group, as well as the 2 CABs that Jamila mentioned, have been instrumental in providing constructive feedback on these planning projects. Previous slide, please. Another resource that continues to be instrumental is our San Diego Cfar Implementation Science Hub. This is co-directed by Drs. Borsica Rabin and Nicole Stadnick, who are lead investigators at the UC San Diego Dissemination and Implementation Science Center. This hub is really a nice marriage of expertise between implementation science experts at DISC, as well as HIV experts at San Diego Cfar, who are working together to provide consultation and technical assistance on different Ending the HIV Epidemic projects. And another aim of the hub is to facilitate translation of local knowledge around the EHE and hub outcomes to build generalizable knowledge through collaborations with other hubs like one at UCLA, and of course the overarching coordination center. And we're looking forward to hearing more about the exciting things coming out of this effort. Next slide, please. And the next slide. The last initiative we want to highlight is one that we're also really excited about, and that is a new Cfar Supplement Award funded by the Cfar Diversity, Equity, and Pipeline Initiative called San Diego Sun, supporting and uplifting new and diverse scientists in HIV. And the overall goal of this program is to try and strengthen the HIV research training pipeline for Black, Indigenous, and people of color scholars. Jamila and I are co-leading this effort, which will basically invite a cohort of pre-doctoral and postdoctoral BIPOC scholars to participate in a 1-year research education and mentor training program. And we're proud to be building on the successes of previous and ongoing training programs, including one that I currently co-lead with Dr. Mari Zuniga at SDSU called ASSET, that is geared towards Black and Hispanic junior faculty who are interested in substance use research. This is just a photo of our previous cohort of ASSET fellows. So just a shout out, if you know any pre-docs or postdocs who might be interested in participating in San Diego Sun, please spread the word because we will be accepting applications in January. Next slide, please. Next slide, please. So to wrap up, we just want to conclude by saying that San Diego Cfar is committed to promoting health equity to end the HIV epidemic. And to do that, we really need to think about how we can better understand as well as address the various syndemic challenges that marginalized communities face, including violence, trauma, substance use, or mental health and stigma. And we also want to promote meaningful and lasting change to see equity not only in the communities that are disproportionately affected by HIV, but also in the HIV research training pipeline. So really thinking about diversifying and strengthening the scientific workforce of individuals who are actually conducting the research with these communities. And through our CABs and efforts we highlighted, we're working to ensure that we're creating community-driven solutions by listening to community members, our community partners, and by actually being responsive to what they're telling us to ensure that we're meeting their needs and designing high impact and sustainable solutions to end the HIV epidemic. With that said, I will now turn it over to Steve for our community stakeholder panel.
Wow, that's impressive. Thanks, everyone. I want to start by introducing our community stakeholder panel to be able to provide some perspectives from the agency and from the community perspectives. Terry Smith is the Director of Sexual Health and HIV Prevention Services at AIDS Project Los Angeles Health here in Los Angeles County. Dr. Jeanette Aldos is the Clinical Director of Infectious Diseases at San Ysidro Health in San Diego County. It's important to recognize this is an FQHC located in the San Diego border region. And Chloe Rios Wyatt is the founder and CEO and president at Alianza Translatinix in Orange County. I'm sorry if I said that wrong or bad, Chloe. So welcome everyone. I wanted to just start off by saying after 40 years, the focus on socio-behavioral work and HIV is finally here. It's time. So I'd like to ask, first of all, why is World AIDS Day important to you from each of your perspectives? Why don't we start there and see what your thoughts are? Terry, you want to start?
Sure. I think it's important to me because it's an opportunity to stop and reflect on the journey of this long 40-year journey that we've been on with HIV, and just to remember all the amazing people who have helped us get to where we are today. And then I think also for me, it's an opportunity to reflect all that I have in terms of addressing the epidemic and bringing it to an end. And the challenges of making sure that folks that look like me and love like me are accessing those. And so I'm encouraged by the journey, and I'm also challenged by it as well. But it's just a time of reflection for me.
Jeanette?
Yeah, I'll echo what Terry said. I have been in this field for quite a long time now, about 20 years. And I do every World AIDS Day try to stop and reflect. I think it's really important to reflect and honor all of the people who came before us who changed the world with their activism. They changed medicine, and they changed the lives for everyone who came after them. So I do take that to pause and learn from them and allow them to inspire me. I try on World AIDS Day to celebrate where we are, where we have something that was a terminal illness for so many people and has now become a disease that I can manage for my patients, most of them with one pill once a day. And it's important to honor those who got us there and then take what they did and say, well, how are we going to bring along people who have been left behind? And that's where the day after World AIDS Day is when we move to the future. And so take that reflection and put it to action, which I think has been well discussed here with opportunities in research, et cetera.
Great, Chloe.
Yeah, I mean, beautiful. I mean, they couldn't have put it better, right? I think it's a day where we all remember those that we have lost, but we also celebrate and honor those that are still with us. And I personally, right, like I have loved ones and people that I know that have been severely affected by the HIV pandemic. And it's great to have this day to sort of remember the past, but also look into the future and with hopefulness that this HIV epidemic will come to an end soon. So I think it's a great day to remember, but also to honor those who are still with us.
If I could build on your comment, I think, I do remember people dying, and I have in my mind names who are no longer here, who are lovely men who are not here, which makes me crazy because it's like, why are we still dealing with HIV? There is no excuse for a single new HIV case, none. So in that spirit, Chloe, can you talk a little bit about, from your perspective in your community, what is the big question that needs to be answered about HIV/AIDS in the next 5 years?
Yeah, I mean, I think from all communities' perspective, the big question is, when are we going to see the cure, right? And I think that's the big question. But I think from the perspective of the Latinx transgender community, one of the questions that come to my mind is, why do we continue to see a lack of representation from transgender women in tables of decision making when it comes to HIV planning? And then to that, I would add, what is the plan to engage transgender people, specifically communities of color, to move closer to ending the HIV epidemic? I think from my community's perspective, those are two crucial questions that come to our mind.
Awesome. That gets me all activated. So Jeanette, what are your thoughts about the next 5 years?
I will echo that. I mean, I think we all know, and that's the point of this presentation today. If you look at what we're looking at in research right now, we have the tools to end the epidemic right now. So why aren't we there, right? And the reason we're not there is really because of syndemics, because of structural racism, because of exclusion of certain groups from the table. So those are the things that we want to focus on. So I absolutely echo Chloe's comments for many groups that have not been brought into the focus of the conversation. So I would say our biggest threats, or our biggest barrier, is really stigma and syndemics. And then I would add to that really sort of structural racism and poverty, and all of those factors really build up to create a barrier to getting our patients to that AIDS-free generation, because we have all the tools now. We don't need, it's great to have more tools, but we have them. It's how do we get the people connected to those tools? And that's where I think we need to turn our attention in the next 5 years if we're going to be that generation, which I do think we can do.
Terry.
Both panelists, both these women said it perfectly, and I couldn't agree more. I would just echo the comment about a vaccine, because I think that's really important. And I think also in terms of looking at the why people are not accessing these and what we need to do differently. And I think also I would just add how we engage the new generation, because I've been doing this work for a long time, and I realize that my time on the stage is coming to an end. Not the stage of life, but the stage of this work. And I really want to see the young people that work for me take this on and make this their own cause. And so what do we need to do to inspire them? How can we step back away from tables and let them kind of inspire us to bring an end to this, because they know, and we need to allow them the space to make that happen.
That's a really good point, and one about I'm sharing with you because I have a thing I've never dreamed I'd be a grumpy old man, but here I am killing it. You know, it's like I got here, I don't know how, but it ended up happening. And this issue of getting the next generation engaged is an important thing, and being able to turn this over. You know, in terms of following that point, how do you think what do you think are the next best steps in terms of ways that researchers, community agencies, members, and other stakeholders can work together for this next 5 to 10 years? Terry?
I think, you know, to Chloe's point, I think that many of these, oftentimes you look at researchers and folks who are doing the work, oftentimes they're not looking like us, right? They're not people from our communities who really understand our communities, who are not looking at our communities from this kind of researcher perspective, really breathing and having a lived experience of our communities. And so I would love to see more trans folks doing research and being involved and sitting at those tables and having really meaningful community involvement. I would love to see community advisory boards serve as a springboard to people getting interested in public health. And so not only just getting a stipend of some sort, but maybe finding a job, right? And really kind of helping tap into that community to really address the issues and concerns of that community. And I think also making sure that when research is done in the community, that information is used to better that community. That the researchers doesn't go off and do a presentation about this poor community, but it's really using their information to kind of better and be a benefit to that community, and just not taking that community to further their own academic journey or what have you.
Love it, love it. Chloe, what are your thoughts?
For me, I think it's very similar to what Terry just shared, but I'll put it in perspective. I am in a very conservative county running an organization that is trans-led, and we did not have any representation in the HIV Planning Council here in the city or in the county of Orange County until this year. So I think that really puts in perspective, right, how much the transgender community is being taken into consideration when it comes to the strategies of ending the HIV epidemic. So I think moving forward, at least here in Orange County, our vision is to create that, to start promoting the participation of other transgender and gender nonconforming individuals in the strategic planning of ending the HIV epidemic, and hopefully motivate other stakeholders to also join and to bringing leadership of transgender and gender nonconforming people to help end the HIV epidemic.
Love it. Jeanette?
I'm going to agree 100% with everything that was said. And I do want to take an opportunity to acknowledge the work of those who've presented here today. I have research partners with on some of those projects, and a lot of those are an example of really reaching out to the community. So our health center is located at the border in San Diego. We're a community-based HIV clinic. Everything that we do when it comes to a research partnership is first starts with the question of, is this good for our patients and our community? Does this project, does this research actually help the people who are being served in the clinic? And if it's just an academic question, then it's out. And so with some of the wonderful partners on this call today, we've had studies looking at stigma, barriers to care, substance use disorders, patient navigation, care collaboration, monetary incentives. We had a partnership for PrEP access for women. And so those are the kind of studies that I hope will translate into actually making life better for the patients who are in care. And so I'd like to see that continue and expand. And then I'd like to see perhaps a little bit more work on the impact of racism and of patients' feelings of welcome and belonging. That's something that we ask our patients about every year, is do they feel included and do they belong here? And that really gets to that idea of engagement and overcoming those barriers. And then some of that work on systems and what models of care work, one of which was presented today, sort of how can we provide the care that's not just you have to come to us, but can we come to you, or can we make it so that you can come anytime, or can we make this model work for you with all of your competing priorities? And more research on that will then show that those things are effective, maybe even cost effective, then they're easier to implement. And I think that gets us over those hurdles to get us to actually use these tools we have to end the epidemic.
Well, I am just so honored to have this discussion. I also want to point out that in the spirit of inclusivity, this is UCLA and UC San Diego and Orange County. Maybe we should fight over you, Chloe, about who gets you to join with us. Whether it's you or whether it's us or San Diego, we'll pitch first. So I love the energy, the thoughts today from Terry, Jeanette, and Chloe. This is wonderful, and hopefully this will only increase the impact of all of our work of working together. Certainly, that's something that's of interest to me. And I want to turn it back now to Dr. Stockman, who will begin with the next phase here, calling us to action.
Okay, thank you, Dr. Chapter. What an excellent panel. Excellent. So reflecting on, based on what we've heard today from researchers and community stakeholders, what is clear to me is that our collective efforts and actions are critical to effectively address disparities and achieve equitable access to HIV prevention and treatment, especially for those disproportionately affected by HIV, often due to some of the syndemics that we heard about today and some of the system level barriers. And it isn't the tireless efforts of one particular sector or group that is needed, but the tireless efforts of community members, clinics, community-based organizations, public health departments, and researchers. And just please note the order in which I listed the many different groups that need to collectively work together. And community was first. And this is because without community engagement and involvement, we are left with interventions and programs that are not utilized and they're not sustained. So as demonstrated by the many different projects presented today, in Southern California, we are and must continue to take a collective action to end the HIV epidemic. So with that, I would like us to think about, I'd like everyone to think about the question on the slide. The question is, what action do you plan to take in your own work to help address HIV inequities and syndemics over the next year? And for this exercise, I'd like you to think about your response to that question and use the Zoom chat feature and make sure your settings are set to everyone. Type your response to the question, but please do not hit send yet. I'll let you know when to hit send. But just take a moment to reflect on what action do you plan to take in your own work to help address HIV inequities and syndemics over the next year. Give you like 30 seconds or so. Again, just type it, but please do not hit send. Okay, so if you all have typed your response in the chat function, please hit send now. And what we're going to start seeing is the responses come through. I believe on the next slide, those responses should be coming through. Not seeing them come through. So what I'll do is I'll go ahead and read a few of these responses. So there's keeping spreading the U=U message to keep fighting stigma, advocate, continue to engage and listen to the voices of our community, key. Increase PrEP education among youth, start up work for my own community here in LA County, community engagement, mobile clinic services, increasing substance use services, reconnecting patients with HIV services who have fallen out of care, mentorship to African-American MSM youth, make sure all clients are receiving adequate care in all medical treatment settings, as well as public and private health settings, develop anti-racist analysis and dissemination practices, promote preventive measures to my community, and finally, intentionally invite community members affected by the associated syndemics to HIV epidemic, planning groups, and research facilities. So many different actions proposed over the next coming year. I'd like to thank you all for sharing your plan of action for the next year. And I personally would like to wish everyone well as they embark on putting their action into motion. So with that, I will transition back to Samantha, who will lead us in the raffle.
Okay, everyone. So thank you so much for joining us today. In gratitude for your attendance, we will be drawing a raffle for 3 $25 electronic gift cards from the list of attendees still present. So in a moment, I will draw 3 names. If your name appears on the screen, please indicate in the chat that you are still present, just as you used before, and just wait for a host to direct message you. Okay, here we go. Excellent. So we have 3 winners. If you see your name on the screen, please just send a message in the chat feature indicating you are still here, and we will reach out to you shortly. Thank you all. And now I'm going to transition back to Dr. Chapter, who is going to lead us in some closing remarks.
So thanks, Sam. And I hope everyone was here to get those cards, because if they don't, then they're leftovers. Anyway, the issue of this has been an amazing moralizing day. I do think that today is a day that really builds pride in what we're doing here in Southern California. I do want us to think more broadly about the Southern California region. But today we heard about work that's ongoing with people who are incarcerated, people who are living with opioid use disorder and close to the streets. We heard about people who are working with mobile youth, mobile health, HIV, people living with HIV who are Black African-American women and experience intimate partner violence, youth living with HIV, peers who have mobile apps to address stigma and reduce and increase treatment in HIV. Latino MSM and intersectional stigma, drug market and drug tourism studies, and with implementation approaches to work with transgender communities, to work with community engagement in Latino MSM, and supporting and uplifting new and diverse scholars. It gives me great pride and a lot of hope for the next generation. And then our community stakeholder perspectives about remembering where we came from and where we're going, being intentional. I like that word, intentional, in being able to promote the next generation of folks who are going to be providing services, to address stigma, syndemics, and structural racism, and to elevate transgender leadership at all the levels, and to also engage our community agencies more with our universities. And with that, I do want to just end by saying thanks to our funders, NIMH, NIDA, NIH, and the incredible work and support from the state of California Office on AIDS, and different folks who are the city of Los Angeles and other funders who are on the call. We couldn't do this without this partnership. Thanks to Chris Gordon, the many other funders who are part of today. And with that, I will close. Thank you from everyone from the UC San Diego Cfar and the UCLA CHIPTS.